on today's podcast.
Because if you just test for toxicants, if everyone tests, you're going to show up, right? But the question is, are those toxicants linked to the problem? And so that's where your questionnaire really helps in matching the symptoms with the exposure and with the pattern of what those conditions look like. So you try to match all that up. And then the testing is really helpful.
If you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level. Thank you, everyone, for tuning in, and thank you, Dr. Harding, for being here today. We've got an amazing episode for you. We are going to tackle the big C word, cancer. Now, identifying and addressing modifiable risk factors for cancer can have a significant impact on prevention and improving patient outcomes. In fact, about 1/3 of all cancers are said to be preventable through lifestyle changes. That's why we are thrilled to have Dr. Debrah Harding, a naturopathic doctor and expert in integrative oncology with over 20 years experience. She's going to help us break down what are modifiable risk factors for cancer and what questions may be missing from your standard medical intake forms that often go unnoticed and surround us every day. Now, I know we've got so much to tackle, so without further ado, I want to introduce our expert, Dr. Debrah Harding.
Great. Thank you, Jen. Thanks for having me.
Well, Dr. Harding, just so everyone listening can kind of start on the same playing field, so to speak, can you explain in your own words what exactly is a modifiable risk factor?
Sure. Modifiable risk factor is a practice in your lifestyle that can increase or decrease the risk of getting cancer in some form. And they're called modifiable because in theory they can be changed. And so giving you an example of what's not a modifiable risk factor would be something like age or a genetic factor or family history of cancer or personal history of previous cancer and other physiological conditions. Those things you can't change, but commonly talked about modifiable risk factors are things like smoking or tobacco use in a different form, alcohol consumption, excess body weight, and physical activity and healthy eating. Those are the common ones that people think of that you can change and that you're pretty well known in conventional medical settings.
Got it. So, and before we jump into ones that are less well known, maybe we missed them on our intake forms in terms of these modifiable risk factors. I want to really applaud you, Dr. Harding. You've spent years working in integrative oncology. So I imagine there are often times when patients say, wow, my doctors or my medical providers have never asked me XYZ or this or that. And they may be a little surprised and maybe even pleasantly surprised that you're asking about these other factors. So as a naturopathic doctor myself, I imagine I'm looking high and low, trying to crack a cold or a difficult case and really put together the pieces of the puzzles to make a difference. So before we jump into those modifiable risk factors that are not so well known, I'm wondering about how do we really build a comprehensive medical intake form? For example, toxic exposure questionnaires. Do you find those useful? Any other tools to round out those intake forms?
Yeah, I think you hit the nail on the head with what are some lesser known risk factors, and toxic exposures is certainly part of that. And the first step to that is to be aware of what are things that are commonly around that people aren't aware of. And so to that end, there are plenty of questionnaires that are out there called environmental health history forms, environmental questionnaires, and that's a really good place to start. And I have some tips at the end about what to put on them. But just in brief, it would be things like chemical exposures, timeline of occupational or residential exposures that are known to environmental toxicants, and then correlations and timing with chronic condition onset, like when did a person get sick? And it should also have radio frequency questions on it or EMF, things about the residents or the occupational area. Are there high power lines nearby? Let's talk about cell towers and Wi-Fi. And so those things are all good features of it. But there are some organizations that have great sample ones for clinicians. And we'll go into those resources at the end that you can start with.
Awesome. I love that you're offering resources for our listeners. That's really helpful so they can walk away with something that they can use in practice. So, what you mentioned EMFs a little bit, and I would love to know a little bit more about that. But what are some other modifiable risk factors, if you were to list them off, that you tend not to see in your typical intake form when you go to maybe your primary care provider?
Yeah. Yeah. So the big ones that I think about would be things like heavy metals. I would think
Mm.
about things such as cadmium or arsenic are kind of ubiquitous and people aren't aware of them. Another thing would be just chemical toxicants. So herbicides, pesticides, occupational chemical exposures, ionizing and non ionizing radiation are also things that can be modified to some extent. Um, and then even just you think of hormonally based cancers, estrogen metabolism is something that oftentimes can be looked at and, if necessary, optimized so that that can become less of a risk factor potentially. It's sort of news you can use when you start digging into trying to prevent hormonally based cancers.
Sure. So such a wide breadth of things that we maybe are missing.
Yeah, and then
All
just
right.
food. I mean, we talked about healthy
Yeah.
diet, Dr. Brown, but it feels like so many times I can't tell you how many, so many that cancer patients will tell me that their healthcare practitioners in the conventional care will say it doesn't really matter what you eat. It's not going
Mm.
to change the trajectory of these things. And that's just not something that's well supported in the literature, actually. But the conventional care does a really good job in general of supporting people through dietary interventions when their treatment has GI based side effects. So, the surgery to the bowel, they can really support them well. Low caloric needs, they can really support them well. Radiation, mucositis, or something like that, that is affecting their ability to eat. Great diet suggestions. But in terms of prevention, to prevention of recurrence, that's not information that is making it from bench to bedside, but it's there. So that's some of the exciting things that I think naturopaths who are generally food focused can give some of that information that's out there to patients and they can use it. Because the first thing that patients want to do after they've gotten through care, or if they just want to focus on prevention because someone in their family has a risk factor, they just want to know, like, what else can I do? And so
Mm.
they've asked that of everyone, and they really don't have much that they can do that's empowering for them. So these types of steps are really things that are empowering for patients.
Absolutely. Okay.
Love that.
Thank you for that. And before moving on to the using of naturopathic integrative oncology therapeutics, when we're talking about prevention, you mentioned EMFs a little bit. Can you speak to maybe a case study or another modifiable risk factor in terms of something you've seen in practice that was really memorable and striking in terms of, speaking with someone and maybe you wish you had known that maybe you wish that they had known what they could have changed before being diagnosed with cancer or anything that they could have used from a prevention standpoint.
Yeah. Yeah, it's an interesting topic. As a naturopath, I tend to be sort of overly cautious about all sorts of possible toxin exposures. And I remember when I worked in the hospital, I was like, I'll work anywhere, but don't throw me in radiation. I don't know how well they keep up those machines, and I do not want to be down there.
Of course.
But then things happened and I became friendly with a lot of the radiation staff, and I found myself going down to the radiation department quite a bit, and then I was transferred there. So then I worked in the radiation department for years and became really focused on that area of helping people. So it was like full circle. But that kind of radiation is ionizing radiation. But I also became familiar with non-ionizing radiation, which is EMF and
Mm.
power lines and things like that. And so when you talk about radiation exposure, that clarification can be made that you've got your, ionizing radiation, which are things that are like X-rays or solar cosmic radiation in terms of astronaut and flight crew exposure, and then medical procedure radiation. And that's all something that to some degree could be modified a bit in terms of when workers are working in those fields, they could take heart the safety measures or not. They can choose. I've been in settings where people are pretty cavalier about some of their safety things because they're there all the time and it's invisible. They don't really see it as a risk. And yet there are studies that show that people who work, especially in interventional radiology or people who work in nuclear medicine, really do have higher risk factors of cancer. And so some of those safety measures can be super important. And some of the flight crews have almost as much exposure as some of the folks in those fields. So what more can be done? But that is sort of like a whole other area. But I think what affects a lot more people in day-to-day life, you and I and everyone, is the wireless and the radio frequency EMF exposure, the non-ionizing. And so to that end, I became interested in this and found it everywhere. When you start looking, everything, it becomes like, there it is, there it is, there it is, you know? So, yeah, so I've been on that trek for a while, but I'll speak to your question, which is about a case study. And so, once you're on this channel for a while, you can see the symptoms of it and see the presentation of it. And this is a case that really represents an aspect of it that you can take and look at and look for in other people. So this case is a female who presented with unexplained cyclical fatigue for about 4 weeks duration. And she had it checked out. She didn't have any fever, lymphadenopathy, any URI symptoms. And it looked like an odd pattern. So how it worked for her was on Monday morning, she would start to feel like she was getting a little fluey. And that for her was like fatigue and muscle aches that increased in severity. Each day it increased in severity. And so on Friday, it was like an 8 out of 10. She could barely move. She's like, I'm definitely getting sick. Oh my God, this has been going on all week. I better take to the bed, kind of a thing. But over the weekend, she would get better. And on Monday, it would start like at the severity of 1. And then by Friday, the same thing. And it never developed any fever or flu. And so, everything was negative. She went to her doctor and then she came to see me. So what would you be thinking, Dr. Brown? How would you work up this gal? What's your doctor mind thinking right now?
You nailed it on the head when you said cyclical. And you're talking about Monday morning, well, typically if we're not talking about the pandemic and working at home, I think maybe just burnout from the job. But she's working at home. You said this is Monday through Friday, and she felt better over the weekend, I presume.
Yep. All gone.
Yeah. Right. Yeah. So, and I wonder where that Wi-Fi is. Is it in the office? Is that router in the office?
I think you got it. You got it nailed. Yeah. I mean, I thought, well, it's got to be work related. Tell me about stress. What's going on at work? I mean, it was nothing new. Work is work. Everyone has a certain amount of stress with work. It was what it was. And so then my next question was, well, just tell me about your work setup a little bit. And where's your router? Well, ding, ding, ding. She was working literally with the wireless router behind her chair, within 6 inches of her spine. And so that was a new setup for her. And it was also like a brand new router. And the newer ones are like more and more powerful than the older ones. And it's like they really want to get that signal out. And so, as you know, probably, maybe our listeners don't know, but the closer you are to a radiation source, the higher the radiation output, and it drops down significantly the further that you get away from it. So there's a huge difference to being within 6 inches or 2 inches or 1 inch of a high emitting RF source, radio frequency source, than it is from being across the room from it. So just the fact that she was right on top of it, I felt like an immediate intervention needed to be made, even if that wasn't the issue. Like, even if that turned out to be like, she still has this going on. But I wanted to make an intervention on that because of what I know about the health effects that can cause. So I gave her a prescription, put the router far from your workplace, and I gave her a whole bunch of other things. Turn down the power settings. I gave her a website to turn it down, put it in shielding around it. I'm pretty much treat it like a hot nuclear potato, right? This is like classic response. And turn it off when you're sleeping. And then I gave her a prescription for all these antioxidants. So, and come see me. Call me if it gets worse. If not, come see me in 2 weeks. So she came see me in 2 weeks, and she said that she I got the message kind of away, moved the router across the room from her workspace. She didn't do anything else. She didn't place a shield around it. She didn't turn it off at night. She didn't take the antioxidants. She didn't adjust any settings. She just did that. But hallelujah, she did that. And so the biggest distance that she could actually get from the router was about 7 feet. Mm-hmm. So she got 7 feet from a router. But nonetheless, her fatigue significantly improved from an 8 out of 10 on Fridays to about a 2 out of 10 immediately since doing that adjustment.
That's fascinating. As I'm staring at my router, I'm like, darn it, I've got to change up my room here. That's incredible.
You can use, Jen. This is the point.
This is why I'm doing this, Dr. Harding, so I can glean wisdom from all of you professionals out there. That's amazing. Amazing.
And amazing that she wasn't complying with anything else, but that was helpful to see that just moving away from it made such a huge difference. I mean, that's a dramatic improvement.
Yeah. So, I know that there's a lot of things that could have been, and it could have been coincidence. But I've seen enough cases like that it's become part of my standard intake questioning when symptoms like this arise. And so maybe it'd be helpful to explain some of the symptoms so that people could get a sense of what to look for.
Yes, please.
Absolutely.
Alrighty. So basically, there is a diagnostic criteria for something called electrical hypersensitivity syndrome. And so we can go into the history of all this, which is really fascinating if you guys are interested. But it came to be not so much that in the diagnostic criteria, not so much that it was causing illness, but that people had a hypersensitivity to it. Of course, I don't know how much politics is involved with that or decisions beyond my awareness, but it's pretty clear that damage happens whether people are aware of it or not. It's just that some people are like the canary, they can tell, and some people can't tell. But it seems that cumulative exposures or high acute exposures can make people more sensitive to it. Or if they have a physical condition like whiplash, interestingly, has been linked to it because there was sort of a disruption between the brain body sort of connection or the blood brain barrier through trauma. If there's been some sort of insult, that people can be more affected by electromagnetic sensitivity.
They may
But
be predisposed.
yeah, so I think having symptoms of it to a degree can be helpful because you can be aware of your surroundings and mitigate it. Of course, there are people who are really struggling with extreme hypersensitivity, and in today's day and age, they can't go anywhere, and that is not helpful. And so there's different tools that you can do for that. But back to the symptoms. Basically, you got your neurological symptoms, which are front and center. And for a lot of people, that's headache, eye symptoms, and tinnitus, ringing in the ears, as well as dizziness and sensory abnormalities, such as feeling like a little bit out of your body. But there's also neurological symptoms that people aren't aware of, which is emotional lability, depression, suicidal ideation in really high doses in studies, memory loss, and loss of the ability to concentrate. And then you've got some non-neurological symptoms which are also super common. And so those would be things like fatigue, fibromyalgia comes up with our patient. Insomnia is a huge one. Skin rashes, it's like a histamine-like skin rash. So if you're always around something near your face and you keep getting these weird breakouts, that could be related. Or cardiovascular abnormalities and heart palpitations, I would see frequently as much as sort of fatigue and headache. And then, a side effect of excess radiofrequency, but not a hypersensitivity symptom would be something like, cancer development. And this radiofrequency was classified as a 2B carcinogen by the World Health IARC, which designates carcinogenicity of substances. You often hear like group 1, group 2, group B. Well, it's 2B, which is a possible carcinogen, with many international scientists calling for upregulation of that or upgrading of it to group 1. But it came out as 2B largely because of the studies of cell phones and glioma. With people, a lot of people don't stick their cell phones to their heads anymore. Do you guys stick your cell phones to your heads?
No, I won't.
Yeah. Well, I definitely won't now.
What was that, Jen?
I said I definitely won't now, but from time to time I do. Yeah. So that's very interesting.
Never then. Yeah. The speaker works well on these models. So
what about earbuds?
Well, there's some question of how much comes and is transmitted right to the inner ear from the earbuds. And so there's a whole class of things that are like these ear tubes that they're not supposed to transmit the radiation from the phone directly to your ear, which is in a sense closer than it would have been if it were outside. Yeah. So I don't love the earbuds personally for that reason, unless it's been tested to not do that.
Yeah.
Of
Interesting.
Course. Yeah.
Well, I'm curious, Dr. Harding, with the research that you've done and the patients you've worked with, do patients tend to be asymptomatic to these EMFs, or do you find that they are showing these symptoms and coming to you or their providers with these symptoms saying this is bothering me?
I got more patients who I saw it as a potential issue than patients who knew they had a potential issue. But a lot of the patients I dealt with or worked with had Lyme disease. And Lyme disease is actually a risk factor for electromagnetic hypersensitivity because of some of the neurological effects of Lyme disease. And so some of those patients were aware of that and felt that, But a lot of times the patients didn't put two and two together. And I can give you another example of that. Is a patient I had, and she presented to the clinic with a chief complaint of bilateral tinnitus, and it was for 6 months. Okay, so that's a whole workup in and of itself, right, Dr. Brown? Am I right? That's a whole like, let's go through all the things. But interestingly, she had seen an EENT. He ruled out Meniere's, and it pretty much said at the end of his workup, I don't really know what's causing it. Associated symptoms she also had were insomnia, dizziness, headaches, and a new symptom of heart palpitations a few weeks ago.
Oof.
So I said, well, all right, when did all this start? And it was 6 months. Okay, what happened 6 months ago? She moved into a new house. Okay, starting to go down the rabbit hole. What about you, Dr. Brown? What are you thinking?
Moved into a new house, you said.
Yeah, 6 months ago, at the same time, this got a lot worse. She had a little, but it got the worst.
Just environmental medicine, we're thinking mycotoxins, environmental toxins, and then we're on the topic of EMFs. And who knows, is the router in the bedroom? That's something on my mind because my router is now in my bedroom. But all of the above is something I would think about. And if it's new construction, then we're even thinking about more environmental toxins. So it's a whole
Those are all
slew of
great
things.
thoughts. Yeah, I agree. I concur. Yeah, so I was thinking, is it mold? What's going on at the house? Tell me more about this. And so nothing was really screaming positive in that intake. I'm asking her all these questions and nothing's really landing. And then I say, okay, well, tell me about your work setup. What's going on there? And she reports that she just got a new router for telecommuting, which is now directly placed behind her office chair, just like the other patient where she works. And I was like, okay, let's talk about that. But also, guess what, Dr. Brown? Her office is in her bedroom. And so she sleeps directly within a foot or two of the same router. So she's in the room all day and all night every day. And so I was like, oh my gosh, that seems like something we ought to change. And so while we sort of worked through more EEMT things, I said, it'd be prudent to do all the things that I recommended for the other patient. And then she said at 3-week follow-up, she reported that she had an immediate change to her insomnia. It was about 85% improved. Her headaches markedly diminished in severity and frequency. She no longer had any heart palpitations. She couldn't recall the last episode. It was prior to our first visit. But she still had tinnitus and dizziness. And so we had to keep that up in terms of investigating and trying to help that. And so we worked on it some more. But I thought it was a compelling story about how quickly some of the other ones just went away. And also maybe that some of that damage is sort of hard to reverse very quickly when it's been going on for a while.
Gosh,
Sure.
it's incredible. It really is. Well, I want to switch gears a little bit, Dr. Harding. We want to kind of move back to the naturopathic medicine and prevention for clinicians. And I'm going to assume that maybe some of our listeners here today are not naturopathic clinicians. So in your own words, can you tell us what a naturopathic clinical perspective is and how, or just some of the core principles that you feel are important to that?
Sure. Yeah. So naturopathic medicine is applying natural medicine modalities to strengthen the body's inherent healing potential. And some tools that are often used are therapeutic diet, herbal medicine, homeopathy, exercise, stress reduction techniques, physical medicine or physical manipulations, hydrotherapy, and other things that fall into the natural medicine realm. And there's certain principles that our profession adheres to: do no harm, treat the cause, the physician is the teacher, treat the whole person, prevention is key, and of course, the healing power of nature.
Great. And for someone listening today who maybe they're not knocking on cancer's door, they're not sick, but they want to be their own advocate for themselves or their family, can you give us maybe one or two very practical things that you would advise them that they can do to help reduce those risk factors? Now, I'm assuming I may already know your answer to one of them, but I'm curious what you would say.
Sure. Well, I would say, first off, like, diet is important. And so I might go into a little bit about, there's a great website and it's called AICR.org, American Institute for Cancer Research. And they have evidence-based suggestions for diet that are very patient-friendly. But the 2018 evidence-based recommendations for them were to do just very simple things that may be hard for patients to apply every day, but it's simple to convey to patients. And that would be 30 grams a day of fiber, and then eat 5 portions or more of fruits and vegetables a day. And those two things, and keep your alcohol intake low or none. And I think those things right there could go a long way for a lot of prevention.
Great. Thank you.
Absolutely. And it seems that we all know eat more veggies and eat the colors of the rainbow, but having those concrete terms, I think, is a really good reminder for people. And providers don't have all the time in the world to educate people on nutrition. So if we can say we can have those concrete measures, that's really helpful for, I think, providers and patients from a prevention standpoint. Absolutely.
Yeah. I mean,
And
that 30
so,
grams of fiber a day is sort of like a goal to shoot for. You get your patients start looking at the grams of fiber. You start adding a couple tablespoons of flaxseed meal. And of course, linking fiber to healthy microbiome in the gut, which leads to healthy estrogen metabolism, which leads to, if you can metabolize harmful estrogen metabolites better, then you can potentially affect your hormonally based cancer risk, especially estrogen based cancer risk in terms of breast cancer, prostate cancer, and others. So eating fiber is like something that's like news you can use, and I don't think it gets enough airtime in terms of how preventative it is. Again, not just for this that I mentioned now or bringing out about the microbiome and estrogen-based cancer, but also for colorectal cancer prevention. I think everyone would assume that, but it is well validated. So that's something that's super great place to start. And then I think working with a naturopath can help too, Jen. Just going to a naturopathic.org and working with a naturopath. Or if there's cancer risk or cancer development, then working with a naturopath who focuses on oncology care can be helpful too.
Yeah. And I do love that you gave us a very tangible number to work with, because oftentimes we get sort of that sweeping generalization, eat more fruits and veggies, eat more fiber, but 30 grams, that's like something we can shoot for, right? Like you said, we can read our labels and we can make sure that we're getting that. So I think that's very helpful.
and it leads to a whole slew of positive events. As you
Yeah.
said, the microbiome, further down, hormonal balance. It's obviously extremely important. So,
Great. Yeah. Simple. Yeah.
exactly.
What's your
And
favorite fiber source, Dr. Brown?
oh, geez. Well, I'm always whole foods first, but it can be tricky if you start adding up the berries and your legumes and what have you. You know, sometimes I find that people, they need to add on. They might want to look at supplements to add on top of the diet if they're not getting enough, or if they can't do raw produce items for digestive concerns. Maybe they've got SIBO going on and they can't digest a lot of produce. Of course, cooked and steamed. But psyllium's easy. It's not the most palatable. It's really not my favorite.
Makes a great pizza crust.
That's
I
it.
said
I didn't know that.
a gluten-free pizza crust. Yeah, I'll have to share the recipe.
Okay, so gluten-free pizza crust with psyllium is a palatable way to get in your psyllium. I love that. I might just say that's my favorite way to incorporate more fiber. I love it.
That's great.
Awesome.
I like flaxseed meal a lot because it's in the flax can help bind to estrogen in the gut and prevent it from recycling back. But also, it's interesting. I've been eating flaxseed meal for years, and I just reviewed. Yeah, I always knew that flax could be a high source of cadmium. Unfortunately, have you guys heard that?
I didn't know that.
Yeah, so cadmium is a heavy metal and has a certain amount of risk for cancer. It can also be estrogenic. Um, and so some food sources that are very healthy are actually also high in cadmium because it's in fertilizers, high phosphate fertilizers, especially. And so it's in a whole slew of foods, and even like healthy foods can take up a lot of it, like sunflower seeds, tofu, flax. But I learned that one of the flaxseed meals that I was using, they did a study on it on this great site called Consumer Lab, where they do studies of products on the shelf and they test for things like heavy metals. And most of the companies of flaxseed meal had high cadmium, but there's one I've been using, which is Spectrum. And I just switched to it because of the cadmium, and it tastes so much better. And they're not giving me anything to say that. I just wanted to share. And I really like that one more than the one I was using. And so I'll just say that some of those things that are helpful to know when you're trying to be more mindful in a way that you can mitigate some of the risks associated with common things that you eat.
What about chia seeds? I do I find that the consistency is nice. A good chia pudding is something I like.
Chia
Any
is
qualms with chia seeds?
I haven't heard anything about cadmium in chia seeds. I will
Fair.
say I have not seen the same results on estrogenic binding capability from chia as I have from flax. However, chia has its own benefits. It just maybe not the estrogen link from what I have read.
Right. Yeah. Every fiber has different benefits. That's why it's so
Yeah.
great to mix and match. We really need a good variety. I agree.
Yeah. You like
Yeah.
the pudding in the morning?
I do. I'll put it with oats. And oats is a whole nother conversation. Is it contaminated with gluten? We could have another podcast. One thing leads to another, right? But yes, I like to mix a little bit of chia in with oats. And then there's hemp seeds, and we could go on and on and on. But fiber, so important. It's really, really something we're always emphasizing as naturopaths, I find in particular. So which leads me to our next question. We've talked about prevention and how naturopathic medicine really shines in terms of prevention. But what about naturopathic care in the context of integrative oncology? If we're really talking about some of the benefits of employing naturopathic modalities alongside conventional therapies, where does naturopathic medicine really offer benefit alongside conventional cancer care?
Yeah, I think it's a great question. I say that over 80% of people with cancer are choosing to use supplements alongside their conventional treatments. So it'd be useful to get good guidance on which supplements to use, which would be the most helpful, the most bang for the buck, so to speak. Separate the wheat from the chaff. There's so many that you could do. Patients could benefit greatly from having a guide through to navigate through that. I also like to say if someone is unfortunately diagnosed with cancer, they get a whole slew of well-meaning suggestions from everybody. And those well-meaning suggestions could get overwhelming and costly. And some of them might not also be okay with conventional therapies. So having a naturopath who's specifically trained with oncology as well as conventional care can be helpful. And that's one of the things, especially that naturopathic oncology professionals are good at, which is knowing side effects of what to combine with what. So they have special training and experience with conventional care, radiation, chemotherapy, surgery, and very specific niche of treatments that are offered and naturopathic evidence-based recommendations to use alongside of it. And some of that treatment to use alongside is to reduce side effects, but some of it is to promote efficacy as well. And one interesting thing in terms of efficacy would be some studies on things like Coriolis versicolor. It's a mushroom, traditional Asian mushroom, studied a lot in Asia and Japan. And there's some really great research out there showing that different extracts in use have prolonged a survival in gastrointestinal malignancies in combination with chemotherapy versus with chemotherapy alone. And then also prolonging disease-free survival compared with no additional treatment in a number of Japanese studies. And so that one is one of the ones, because it has been in use for so long in other countries, that has a slew of articles about how the combination of using it with care is greater than either, especially conventional care alone. So that's an example I like to give. But having that in your hat or in your toolkit to offer that can not only potentially reduce side effects, but also help potentially with immune response or treatment outcome would be cancer patients would want to know about that. So.
Awesome. So, Dr. Harding, I've read some of your past articles or interviews, one in particular that had to do with breast cancer that I found fascinating. And clearly, you stated you're an advocate for a both and approach to treatment, where naturopathic medicine is used to make conventional treatment more tolerable. And the field of naturopathic oncology speaks to a greater efficacy in cancer care for this combined approach. So, can you expand on that a little bit?
Yeah, that's sort of the example I'm giving about using the Coriolis mushroom alongside of care. Or another example of that would be if naturopathic care can additionally help, and I've seen it help many, many, many times over, it can help reduce treatment side effects, then the person can remain and get their full course of treatment. I'll give the example of maybe someone who has a head and neck cancer who gets radiation therapy, and that could cause a very painful mucositis and where the person can't eat. And it can potentially, the skin symptoms as well as the mucous membrane symptoms can get so intolerable that sometimes the patient will have to stop treatment and then wait for that to heal up a bit. And so that treatment interruption affects outcomes because they weren't able to get the treatment, the full treatment in the full amount of time. And so if naturopathic care can be employed to help reduce severe side effects of treatment, and get them to tolerable, for example, then they're getting a better outcome from a full course of care, of traditional care. So not only do you have some things that are studied and conditioned in accordance with conventional therapies like the Coriolis, but you also have just an improved side effect, which optimizes their conventional care.
Makes sense.
Does that make
Yeah,
sense?
Yeah,
absolutely.
absolutely. And I would assume that, and from what you said, with the majority of patients actually supplementing, do you find that there are a lot of patients, at least that you work with, that are open to this? Obviously, if they're coming to you, they're open to it, but your time that you did spend in the hospitals.
Yeah, being in the hospital was great because you didn't get the self-selected patients. It was pretty much everyone got an appointment with a naturopath, whether they heard of it and wanted it or not. And so that was great to reach those people. It was very rewarding because it took all of 2 minutes for the person to say, yeah, I want to try that most of the time. Because if they're in pain or if you're making a rational suggestion that makes sense to them, there's no reason at that stage that they wouldn't want to try something, at least for a while, walk on that journey a long ways with you and see if it helps them, and then have their own experience of it. Because like they can be the best guide of what works after that. But the introduction is very nice in the hospital setting like that to a lot of patients who wouldn't normally reach out for it.
Great.
Makes sense, of course. I don't see why someone wouldn't want the additional support of naturopathic integrative oncology care. As you said, you're giving very practical recommendations. It makes sense. Maybe there's a skeptic here and there, but I'm sure you won them over pretty quickly once you start talking about these very, very easy to understand, practical things that are just going to enhance and really, really complement the conventional therapies. So
Yeah.
definitely see
Yeah.
the
And it's
benefit
hard to
there.
find cancer patients who aren't taking things these days that that their family and friends have given them or they have tried. So it's more the norm than not.
Right. And you touch on friends and family. And so that really brings up the topic of the importance of having someone like a naturopathic doctor who has the knowledge, they have the experience, and they can speak to maybe interactions. And but that's a conversation for a different time. So but on that note, what are some common misconceptions surrounding naturopathic integrative oncology that maybe you'd like to dispel now for us?
Oh, sure. Yeah, I think one common misconception would be that it's an alternative care pathway,
Mm,
that naturopath would be dissuading the patients from seeking conventional care, and that is a false belief. Naturopathic doctors are very much part of a care team and integrated care model, and don't want to dissuade patients from doing anything that could potentially help them. And naturopath also doesn't function just like a traditional primary care physician doesn't function as a sole practitioner to a cancer patient who has multiple needs. Just like a family doctor can't meet all those needs. They can't give them treatment for radiation. They can't give them surgery. They can't give them the
sure.
consults on these highly technical and specific things. A naturopath can't do all that either. So being a part of a team approach for the patient is best for everybody. So everyone can share notes about what everyone else is doing, what problems have been arising, and brainstorm different ways to intervene. So I think it's not meant to be a silo. It's meant to be helpful to the team at large caring for the patient.
Right. It's a team approach. That's important to distinguish. And I see, so you have FABNO, you have ND and FABNO as a credential behind your name, Dr. Harding. Can you speak to what that means? It stands for Fellow by American Board of Naturopathic Oncology. What does that certification process involve?
Yeah, in order that involves either having a 2-year accredited residency focused on naturopathic oncology, and that has to be an approved residency, or be in practice 5 years with over 2,200 oncology patient contacts. And then you have to submit cases for review by examiners. And then you have to have at least 50 hours in oncology related topics of continuing ed. So after you have all that, you can apply. And that takes a number of years after graduating to accrue that much experience, patient contacts, etc. And then once you have that approved, you can sit for the exam. And that's a board certification exam, which is very lengthy. And then passing that, you can get that credential.
Thank you for walking us through that. I think listeners will appreciate that. Providers and patients alike really want that information. And where can they find practitioners who offer naturopathic integrative oncology care. I think there's limited number of naturopathic docs who have the FABNO certification, but is there a provider directory? Is there a resource that you like to guide providers and patients to find providers who offer this type of care?
Yeah, absolutely. They OncAMP. So that's ONCAMP.org.
Beautiful. And what about if they don't have FABNO? What if a provider, I mean, of course, they're working with a conventional oncologist. I imagine there's dietitians on board at CTCA. Were there other providers who you worked with? I'm curious, as part of the as part of the holistic team for the patients.
Yeah, at CTCA
Yeah,
or
just
in
curious, and
general.
in your all of your experience.
Yeah. So in an integrative hospital setting, there would be a dietitian, there would be physical therapy. Often there would be mind body medicine. So there was really great because the patients could get Reiki or they could get massaged quite regularly. And they could have other types of stress interventions, which were helpful. So,
I love that. We're
yeah.
really supporting the patients from all of these different angles with all these different modalities. It's truly comprehensive care.
Yeah.
It's
Yeah,
amazing.
in terms of any of the interventions or any of the modifiable risk factors, or I know we're probably ending soon. Are there any others that either of you would be interested in, or your providers potentially, in terms of testing or anything like that? I could summarize a few, or anything else you think might be helpful.
I
Yeah, I
mean,
mean,
I'm sure, yeah. Anything you want to expand on, Dr. Harding, feel free.
Well, it's just, I mentioned things like heavy metals, estrogen metabolism. I also mentioned EMF, and I think one thing that could help patients is once your provider does like an environmental health history questionnaire, it really leaves you in the direction of what might be useful to test. But you don't have a sense of the patient's history, the patient's condition, and where to put your finger on testing. Because if you just test for toxicants, if everyone tests, you're going to show up, right? But the question is, are those toxicants linked to the problem? And so that's where your questionnaire really helps in matching the symptoms with the exposure and with the pattern of what those conditions look like. So you
Mhm.
try to match all that up, and then the testing is really helpful. And so I really like Vibrant Wellness, and they have um, tests like the environmental tox test. They have estrogen metabolism tests to really look at those metabolites. So we didn't get much into it, but certainly some pathways of estrogen metabolism can yield more sort of oxidative and damaging metabolites than others. But working with things like the microbiome and estrogen modulating supplements, you can really work with that. And we have a urine hormone test, which has the estrogen metabolism on there. There's something else, the last one I really like, which is 80HDG. And this
Mhm.
is a measure of oxidative stress damage that's released when the DNA tries to repair. And so that particular marker is a marker related to cancer, not only risks of cancer development, but also cancer severity in a lot of conditions. So that 80HDG is linked to so many things. Like if you start testing it, it's linked to cadmium, it's linked to arsenic. There's interventions that reduce the 80HDG from cadmium exposure, for example. It's linked to pesticides. There's so many things it's linked to, not only toxicants, but also cancers. So keeping your eye on an 80HDG is interesting information. And we have that as part of our urine test. So I like that one as well. Have you
Yeah.
had much experience with that, Dr. Brown, the 80HDG?
well, we see it on the urine hormones test, and I oftentimes see it elevated. I think that I haven't really run the numbers, but it might be half and half. I oftentimes see it elevated, and to have that conversation about antioxidants, and I've even seen an association with poor COVID outcomes when 80HDG is elevated. So really fascinating marker and something to pay attention to. And that was a newer one for me when I started looking at our vibrant urine hormones test. So and if we can bring that down and use that as a modifiable risk factor, fantastic, right? Patients want to see things that we can measure and we can
Yeah,
move.
measure and then make an input on. Yeah, I think it's really exciting. I feel like it helped when I was approaching a cancer patient's list of supplements. And I would say, there's always a million things we could do. Let's look at the 80HDG. And if it wasn't really elevated, then we wouldn't throw every antioxidant under the sun at them. We would go a different route of support for them.
Right.
So I found it was helpful when it was positive, and it was also helpful when it was negative in a patient you might expect to see it positive.
Right. And when we can refine the pill burden and the supplement fatigue, that always
Yeah.
feels good. You know how I like to edit. So if we can take some things out of the shopping bag and shelf them for a while, that always feels good.
So if I could just bring us back full circle, Dr. Harding, to sort of that intake form and kind of wrapping up here, is there any suggestions you could give providers of questions that they could put on their intake form that would sort of peel back that onion and give them those answers that they're looking for to sort of test for those markers that you mentioned?
Yeah, well, I think a great place to start is one more resource called the National Association of Environmental Medicine, and it's envmedicine.com. They have tons of resources, including a really, really well-grounded questionnaire, environmental questionnaire form. So just to give someone a reference for what one looks like, it's very extensive. They're often 2 to 3 pages of questions focusing on exposures. Are you currently using hair dye? Are you spraying chemicals? For pest control, was your house bombed for termites or fleas, or I think bombed for fleas, but treated for termites, something like that. All those things are on there, and so it's great. And as I mentioned earlier, I really like to add things about the EMF questions to it. I don't know if they have it, but I think those are helpful for a lot of patients as well.
Yes.
So, but that
Where
resource is
is your
great.
router?
Yeah, get some distance between you and your router. And then, there was an article I wrote about the Zoom fatigue. Is it, that term Zoom fatigue was sort of popularized. And is it just being stressed about being on camera, or could it be electromagnetic hypersensitivity? And so there's a ton in that article out there. There's a ton of other things you can do to, besides moving away from your router, potentially shielding it with shielding materials or turning down the power settings, because that power of the EMF is powered to go to the neighbor. And you know that because when you go to click online, what do you see? All your neighbors EMF. And then so strong enough, it's blasting to you. And so nobody knows how to turn down the power. Like it's on the factory setting, it's on full blast. And so, they don't tell you to do that. So nobody knows to do that, but you can do that. And then you reduce your power oftentimes to 50% or 25%, and you can still stream everything you want to stream depending on your layout. So, but then you just did it right there. You don't even have to, do other things. You've reduced 50% of your exposure just by doing that, and you didn't even notice. So stuff like that, I think people need to know.
Yeah, that's great advice.
Well, I could talk about that all day. And I had no clue I could turn down the router from being full blast. And of course, the internet provider is not going to tell us that. They hook it up and they run out of here as fast as they can, right? And then I spend 45 minutes on with them with issues regardless the next day. But that's such valuable information. Thank you for sharing that, Dr. Harding. We went over a lot today. To wrap it up, everything from screening our patients for environmental toxins, EMFs, things that are overlooked that could be contributing to cancer risk. And these are things that we can modify, right? So we can educate our patients. We can turn our routers down from full blast. We can be aware of things are in our environment that we can substitute with healthier options, and really touching on the prevention of naturopathic medicine in terms of cancer and the good work it does alongside conventional therapies is really, really, really important. And I'm so glad we touched on that today, because naturopathic integrative oncology, it's out there. People are using it. We want to use it safely alongside conventional therapies for improved outcomes, prevention of recurrence, reduced side effects of medications. So thank you so much, Dr. Harding, for being here today. To close up today, we're going to ask you 3 rapid fire questions to have a little bit of fun.
All right.
All this talk of EMF, I'd like to know, be honest, do you unplug your router every night before you go to bed? Please tell me now.
Okay. All right. We do not, but there is a time setting on a router that you can time for when it turns on and when it shuts off.
Smart.
So that's the smart way of going about it, in other words. Okay.
You can look for a router that has that capability when you buy it.
Oh, wow. Even better. Good to know.
Yeah.
Well,
but I think we had an update or we did something and that feature got shut off, Dr. Brown. and also like we didn't set it quite right. And then somebody wanted to get up early and use it, or somebody was up and like wanted to watch TV, and so we have it. We used it for many years, and currently I think it's off from one of those reasons. So it's a good reminder to get that back implemented. So there you go.
Okay, good. I'm glad we're having this conversation then. And now I have to research how to do that.
Yeah.
Yes.
But I
Lots
did
of Google
measure our
searches.
bedroom, and it's not super high to our bedroom when it's on, but why have it be on at all when we're resting, right, Dr. Brew?
Yes, I'm pulling the plug every night.
All right.
Yeah,
I love it.
You have to. If it's in your bedroom, you have
you
to.
got to. I
Yeah, you
have to.
All right. What
right.
else? What else you
Dr.
got for me?
Harding,
You're ready. Round one. Ching.
ready. Here you go. Number 2, if you could go back in time and give your younger self one piece of advice, what would it be?
All right. One piece of advice. Um, you know, that's a good one. I think if something seems hard, maybe keep visualizing what it will look like and how satisfying it will be to have achieved it and use that as an impetus to get through it. I think sometimes in my life I might have pivoted rather than persevered. So if it's really worth it, keep visualizing it and persevere rather than pivot.
I love that. I love that. Push through. Yes, persevere. It's great
Yeah,
advice.
can't do it with everything, but the big things, that are really meaningful, give it a try. I'm surprised that, how much help you might get in that process.
I love it. All right, last one. Here we go. If there's one piece of advice you could give the world at large, what would it be?
I think if we underline the value of lifestyle and prevention medicine, and if it were a first resort and it were always part of routine medical care, if you had someone such as a naturopath or other holistic minded professional really going into lifestyle factors for patients, and that were sort of routine, that was like the first thing you did instead of like what you did maybe extra if you wanted to, then that would help a lot of people. So naturopathic medicine is a first resort. How's that?
I love it. And that's a perfect way to wrap up. Thank you so much for being here today, Dr. Harding. Thank you for your expertise. And I know I gleaned so many nuggets of wisdom from this conversation today. I'm sure our listeners did too. Listeners, thank you for joining in. Make sure to subscribe and leave a comment. Let us know what else you want to hear about. And in the meantime, we'll see you all next time. Thank you so much.
Thank you. Thank you very much for having me.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.